Hi, Kyle Goeman here. We're going over MNsure today, and we're going to look at how this affects you and how all these changes are going to impact your rates. Stay tuned.
This is a private video and is not recommended for public distribution. For full health insurance and MNsure advice, please contact MNsure or go directly to their website at mnsure.org. For this year, for coming up 2014, start off to see where if you qualify for MNsure, you have to look at your current 1040. Now, if you did a 1040 easy, it'd be line 4. If you did a 1040A, it'd be line 21. Just a regular 1040, you're looking at line 37 for your adjusted gross income. This amount is going to tell us everything of where you apply and where to start. So it helps to have a good tax professional to help you understand your taxes and go through them, and to also tell you what you can do to lower your AGI to see if you qualify for more. There is a chart, I will put the link below, from MNsure, and basically there are 3 areas. There is medical assistance, which I'll highlight right here. Medical assistance is 200% or less. Then there's MNsure, which is 275 to 400%, and then there is the private market. You'd fall outside. So depending on your family size and where you fall on the federal poverty level, that'll tell you where to apply within MNsure guidelines. Like I said, this is really MNsure 200% on up. The rest is really medical assistance, Medicaid, or Minnesota Care. Not MNsure, but Minnesota Care would be in this area. So I will put these links below so you can see these. To find out where you fall on the chart, there is a good website that we use that will help you see where you calculate your AGI for 2014. The link is, I'll bring that up right now. Okay, this is a website. It's Kaiser Family, and what you can do is you can select your state. So for instance, we're in Minnesota, and we'll just say let's go with 56201. That'd be Wilmer, Minnesota zip code. You can enter your income in dollars or percentage. I'm going to do 2014 income. So let's say I'm a single guy and I'm estimating my income's going to be $22,000. I'm just guessing. If you have questions, you can click on here and it'll say enter the total annual household income. Well, we're doing just a single dependent, single person, 22,000. Is there employer coverage? We're going to say no. Number of family members, well, it's just the one. And then adults, number of adults 21 and older. We're just going to say we're 1 adult. Do we use tobacco? No. No children. You can hit submit and it'll just basically calculate it, and it'll say you are at 191% poverty level. Estimated premium, we'll go through all that stuff, but we see 191. So we look at the MNsure chart. At 191, we would fall right here, 22,000. Obviously, $22,000 is where we are as a single person, so we're going to qualify for Minnesota Care. So at that point, once you know that you qualify for Minnesota Care, you have a few options. One is you can stay on your current plan that you're currently on and just be mapped over. So one example is, once you know where you fall on this chart, what you can do is you can stay on your, let's say you're with Medica or Blue Cross for 2013, you can stay on your plan that is mapped over. Now your mapped over rate is going to be less than the new qualified health plan rate on MNsure. So when they say you're going to get 20% off, it's not 20% off your 2013 rate or your 2014 mapped over rate, grandfathered plan mapped over rate. It's 20% off the new qualified health plans, which when we compare them apples to apples, we're finding the qualified health plan is about 30% more than the mapped over plan with Blue Cross or Medica. So for example, you would have to make sure you're getting at least 30 to 40% off on a MNsure product in order to beat your grandfathered plan. So like I said, you can do that, or you can stay on your current plan and just let it map over, which is preferably the best thing to do depending on your AGI, your adjusted gross income. You can drop your plan, you can go on the new qualified health plan or Minnesota Care or medical assistance, depending upon where you fall on. There is also another option. You can go through these third-party plans. Some of them are short-term health insurance. Some are critical illness plans. They are a type of health insurance. It's not qualified health insurance. You'll probably have a penalty to pay. The last option is you don't have to have insurance, but you will have to pay a penalty. I don't know how they are reconciling the penalty yet, but it's 1%. I know it's 1% of your adjusted gross income as a penalty, or $95 for the year, so not too bad. Another note to look at is on dental. If you have children that are under age 19, they have to have dental coverage. That is in the mandate. It's part of the EHB, the essential health benefits that a policy has to have. So your kid does have to carry dental. We don't know what the penalty is yet. So a good site, most of them have to go through Delta Dental. I'll put the site link below, but these are all the guidelines basically saying that come January 1st, you have to have dental. The minimum plans we're seeing are $23.50. So it is what it is. If you do not buy the dental, we know Blue Cross Blue Shield will reconcile this and they will drop your plan. Medica has not told us what they are doing yet. As far as we know, they are not going to reconcile this. So if you don't have the dental and you're on a Medica policy, it's just a matter of when you're going to pay the penalty, if there is going to be a penalty, or what it's going to be. So there are a few other calculators I have that I'm going to go through right now. If you have a Medica policy, there is a website. It's personalplansmedica.com. Renewal, you should receive a letter from Medica that has a renewal code. Now this code is specific to just you. When you enter it in, and you take the group number off your card and hit log in, it'll say your name right here, and it'll also show you your 2, 3, 4 options on a grandfathered plan. Like I said, now a grandfathered plan is 30 to 40% less than the new qualified healthcare plan here. So if you look at your rate and you say, you know what, I still want to see where I qualify in MNsure after looking at your adjusted gross income, look at the guidelines. That's going to depend, that's going to tell you where you fall. So you do have to do a little bit of homework before you do stop in and go through this. If you're on Blue Cross, you can go to rates.bluecrossmn.com. All you need is your zip code and your group number from your card, and from there it'll show you your current plan and the mapped over plan, where you can go or what you can do, and I'll tell you that rate. But like I said before, everything starts with your adjusted gross income from your 1040. That'll tell you where you end up on the MNsure chart, and from there you can tell what to do. So time is limited on this. The federal government has said by January 1st everybody has to have this. Well, not everybody has to have it. They really have to March, the end of March, to do this. But for January 1st, 2014, if you want to start January 1st, it has to be done by December 15th. So December 15th is a critical date for this to get started or to go through. Other than that, everything is set up like I said before. It's just a matter of coming in, doing some of your homework, having that 1040 in place, or knowing where you fall on this scale, because depending upon where you fall on the scale, that tells us as insurance agents, brokers, assisters, it tells us what to do. If you come in the office and you're single and you made $14,000, there's no point in us spending 2-3 hours trying to log into MNsure when you can just go right to the county and apply for Minnesota Care now. Same with medical assistance, but that is by an assister by sister basis. We have navigators in our area too that can help you. That's what they're signed up to do, is help navigate. So as assisters, it really depends on a client by client basis how we're handling this, but I know for Goeman Agency, we are calling all our customers and helping everybody transition through this. So depending upon where you're at, like I said, no more health history is required for 2014 going forward. So that's going to impact a number of groups, and I will have another video and a link for groups if you have questions on that.
Hi, Kyle Goeman here. Today we're going to look at MNsure and the new federal healthcare exchange in the state of Minnesota and how all these changes are going to affect you. Stay tuned. Hi there, Kyle Goeman here. We're going to go over MNsure rates, all the changes, how your current plan and new plan for next year is going to change, and how everything may affect you premium-wise, benefit-wise, and what you can do in 2014. Hi there, Kyle Goeman here. Today, we're going to look at MNsure, the new healthcare